Hello, and welcome to my presentation on multimorbidity in the older adult population. So what is multimorbidity? Well, multimorbidity is defined as the coexistence of two or more chronic conditions. So this would be happening all at the same time. Who is affected by multimorbidity? Well, it's not just an issue that older adults face, but its prevalence is much higher in the older population, with 65% of people aged 65 to 84 years and 82% of people aged at least 85 years being affected. The prevalence of multimorbidity is greater than 60% worldwide. This number is greater for those who are a part of the older population. The occurrence of multimorbidity not only increases with age, but with social deprivation as well. Causes and risk factors. So people are living a lot longer now due to advancements in healthcare. This is the result of research, policies, and social action and development. And with people living much longer than ever before, there is an increased chance of people developing multiple health problems. Some of the risk factors for multimorbidity may include genetics, socioeconomic factors such as financial insecurity during childhood, continuing into adulthood, or lower levels of education, etc. Lifestyle, which for example would be smoking, alcohol use, poor diet, lack of physical activity, etc. So what is the issue? Many of the services available are tailored to meet the needs of people who would be considered young or only have one disorder rather than many. It is often believed that if a person has multiple conditions, the best way to treat them is by combining the treatments that would be used for each individual condition. Effects of such treatments may vary if an individual has multimorbidity. Thus, it is pertinent to remember that what works for those with one disorder does not necessarily work for those with multimorbidity. And if you combine treatments meant for individual conditions, then the effects could be either therapeutic or adverse, but it won't necessarily be known until the treatment has been undergone. So, what is the importance of addressing multimorbidity? Multimorbidity consumes considerable societal resources and demands the development of novel systems and approaches. It is an issue that can affect anyone, and because everyone ages, this is something that we must be aware of. And because of this, I believe that we should aim to improve the current approaches to care for individuals who have multimorbidity. I'm going to discuss some prospective approaches to the issue. So the first prospective approach would be person-centered care. So the National Institute for Health and Care Excellence, or NICE for short, aims to improve the quality of life by reducing treatment burden, adverse events, and unplanned or uncoordinated care by accounting for one's individual needs, preferences for treatments, health priorities, and lifestyle. NICE's guidelines suggest there is a need for care that accounts for multimorbidity. Another prospective approach would be the use of interprofessional collaboration. In an article called Multimorbidity in Older Adults, author Marcel E. Salive suggests that interprofessional collaboration could be used for the treatment and self-management, or patient-oriented education, of multimorbidity. Another way to approach the issue here would be to account for the needs of individuals who have multiple chronic conditions. Subhay Banerjee of the Center for Dementia Studies explains that in order for healthcare to be more inclusive for those with multimorbidity, it would need to be multidisciplinary, integrative, and patient-centered. Integration needs to occur so that older adults with multimorbidity can have their conditions managed without separation from the younger population or those with only one chronic condition. This is why multimorbidity is something that needs to be addressed. Thanks for your time.